Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Mayur Jain, cardiologist and director of Jain Cardiac Care. Today we will be delving into the silent epidemic that India is combating, which is heart failure. In India, majority of patients grappling with heart failure are surprisingly young adults. It's a common occurrence to witness that young adults coming to our clinic for medical assistance considering heart failure. Unlike the Western countries where heart failure is primarily a disease of elderly. Let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people hear this diagnosis of heart failure, they think it's the end of their lives. It is not so. The term heart failure may be frightening, but it simply means your heart is struggling to pump the blood as efficiently as it should, or it is not able to take the blood as efficiently as it could. The ejection fraction or EF measures how well your heart pumps the blood to the body. It is the amount of blood pumped out of your heart's lower chambers called left ventricle each time it contracts. While a normal EF is around 50 to 70%, individuals with heart failures can typically have the EF of less than 45% or even lower. We also have a condition called heart failure with preserved ejection fraction, where even with a normal ejection fraction, patient can have heart failure. So let me go ahead with the second option or second question. Why are so many Indians affected by heart failure? Genetics plays a very significant role. Indians are genetically more vulnerable to cardiovascular disease. In fact, we get this disease a decade earlier than the Western population. The reason is genetic makeup, increased stress, the introduction of junk food into Indian market, causing hypertension, diabetes, obesity to come at an early age. Also, tobacco use in the form of smoking or eating worsens this epidemic. Moving on, what are the signs and symptoms of heart failure? How do you know it is heart failure? So you should watch out for early fatigue, breathlessness on walking, heart palpitations, nausea, sometimes loss of appetite, vomiting, swelling in your feet, orthopnea, which is when you feel breathless when you lie down, and cough when you lie down. That is a very important symptom of heart failure. How can we protect ourselves from this disease? There are very many things which we can do to protect or prevent a heart failure. First of all, early detection of heart failure through regular blood tests and regular visits to your cardiologist. Dietary adjustments to maintain heart health. Incorporating daily exercise into your routine. Practicing stress management techniques like yoga or pranayams. Quitting alcohol, tobacco, and smoking is a very important part. Lastly, what comes next after heart failure diagnosis? So don't be disheartened when you're diagnosed with heart failure. There's a lot of many treatments for heart failure now with the advances in medical science. You can still lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. There are multiple medications, new medications now available, which can increase the ejection fraction by a small fraction. Plus, there are device therapies like biventricular pacemaker, which is called CRT, CRT-D, which is an intracardiac defibrillator, and heart valve repair or replacement. And as a last resort, if condition is not treatable by all these medicines and these devices, then heart transplant remains the last option, which also is gaining very good popularity in India and picking up progressively. And we have very good results with heart transplant nowadays in India. The lifetime risk of congestive heart failure is 1 in 5 for both men and women. So you have to remember, awareness and proactive measures are the key in combating this silent epidemic. Thank you.